If a woman has heavy periods, pain, low blood count, like means anemia, or she's experiencing severe cramping, painful periods, infertility, or some bladder bowel problems, she could need treatment. So before we decide what is the best treatment, we should be sure about some conditions related to fibroids. We need to know how many fibroids do you have, how big they are, and where are they located. If you are thinking about getting pregnant, like for the first time or again, or if you are done with pregnancies, if you want to keep your uterus or not, if you're thinking about not conserving your uterus, and how old are you when if you had any treatments before. So from there on, there are many options of treatment of uterine fibroids. Those options could include medical treatment, that means medication and not surgical treatment, some hormonal therapy, some surgery, and some minimally invasive procedures. Okay, let's talk about medication. As I told you before, the fibroids depend in the most of cases of the hormones. So the hormonal treatment would be a good choice for some patients with fibroids. Some patients, as I told you before, could have fibroids and they could have no need for treatment. They could just have the fibroids there, but they're not big enough, they're not having symptoms, or they're just reaching the menopause and they probably won't need any treatment after that. So if we reach to the point that you have a lot of symptoms and you already know that you have the fibroids, then we're gonna just move on and try to give you the best treatment you can get. The medical treatment is a good choice for young patients with not really big fibroids and are thinking about getting pregnant. Those patients need to be sure how big the fibroids are and how bad the symptoms are, because depending on those two things, they could be good candidates for the medical treatment or not. Okay, after said that, if you're not a good candidate for the medical treatment, then we're gonna start talking about the surgical treatment.